I'm Dr. Michael Latola.
And I'm Megan Strong.
In this week's Case of the Week, a dentist writes in wanting a very, very, very thin veneer that's very, very, very translucent on a very, very dark stump shade. Hey, no problem, doctor. At the same time, let us go ahead and solve the Mideast crisis for you.
Yeah, and find out why Miley Cyrus is singing "Don't Break My Tooth, My Achy Breaky Tooth."
And in viewer mail, a doctor writes in with two great CAD CAM questions showing the beauty of how CAD CAM dentistry is making it easy for all of us. That and more on today's Chairside Live. Hey now, hello and welcome to episode 131 of Chairside Live. Megan, how are you?
I am good. That was interesting.
That was.
How are you doing?
That was the inflection of my voice being used to stimulate and enthrall an audience.
Wow.
Effective, huh?
It's going to be a good episode.
Oh, I'm good. That's what you asked me.
Yes,
How are you?
I'm doing well for the second time in the last 30 seconds.
The whole crew's freaking out that people at home are going to have trouble focusing on the pattern on your dress.
No. It's fine. I've worn it before. Whoa.
And it
I
caused
just admitted
3 car accidents from people trying to watch it on their phones while they were driving. And
No.
it blurred their eyes.
Well, you should, first of all, a little PSA, you should not be looking at your phone while you're driving.
True. I wonder how many accidents happen where people aren't looking at their phones nationwide every year. I'm going to say 3. Yeah, exactly. I think you're a little high, but 3. Well, we've got an interesting show for you today. We have a good case of the week. It's a case where a dentist tries to accomplish a little too much. He wants a very thin veneer that's very translucent on a very dark tooth, and that all adds up to not actually working. Let's take a closer look at that case now. Here's a case I just pulled off the floor from the all ceramic department, and this is a porcelain V-veneer case that's not entirely spelled correctly. V-veneer is our name for our lucite reinforced veneers that we do on teeth number 8 and 9, and very, very, very thin veneers is what they're requesting. 3 varies, and stump shades are dark brown. Patient's teeth are very, very, very translucent and light. Please match the color to OM1 marked orange, and then they sent along an OM1 shade tab marked with orange. Believe it or not, we have a few of these laying around the lab, and I'm talking hundreds of them. So you don't need to send us shade tabs. We actually have a bunch of these, and we know exactly what OM1 looks like. But what we could use here is exactly what dark brown means in terms of shades. And so if you look at a stump shade guide, for example, and Ivoclar changed the name of this from the stump dye material to the natural dye material so that you didn't have to say in front of your patient, say to your assistant, hand me the stump shade guide, because stump never sounds very good when you're talking about somebody's tooth. It makes it sound like they've bit into a landmine and now you're going to try to work on their stump. So this is made for different prep shades. And this is a shade guide that you should have if you're doing anterior dentistry, because there's definitely times where we need to take into consideration, is the color of the prep going to show through? And so all we have from the office is that the stump shades are dark brown. Now, it's tough to say, does that mean this? Because there's a lot of gray. Does it mean kind of this coffee color? What exactly is the dark brown? It would have been really nice to have a picture of one of these next to those preps at the same time so we could get an idea of how dark they were. And at the same time, they're asking for veneers that are very, very, very thin, and they want us to match natural teeth that are very, very, very translucent and light. And so we're kind of at odds here, because if we want to do very thin veneers with dark brown stump shades, that's going to be very difficult to pull off, especially with something as translucent as V-veneers. We might have a better chance with something like Emax, and we might have even a better chance with something like Bruxer at blocking out these dark brown shades. But the problem is that as we work our way up in strength, we're getting less translucent, because we want to block out the dark brown. And so there's really only a couple of answers here. The doctor needs to prep more and block out the preps themselves. There's a certain amount of opaquing we can do on the inside of the veneer, but this is exactly the kind of case that gets me to lean towards crowns in the anterior. And yes, we want to be conservative, and yes, the patient wants to be conservative, But there's no magic here. This is kind of magical thinking to think we're going to do very, very thin veneers on dark brown preps and still have them be very, very, very translucent. And light, those things are incompatible. Something's got to give. Whether it's opaquing the dark brown, whether it's making a less translucent veneer or a thicker veneer or even a crown. I've had cases where we put porcelain veneers on dental technicians with tetracycline staining and they looked awful. We ended up taking them off and doing all crowns, and then the patient was happy. They were convinced now that veneers wouldn't work. So let's look at the virtual design of these. So you can see that we've got the preps are here, and then you can see we've got the proposal that's been proposed here. And if we look at the thickness of these proposals, and I just clicked on one spot, and we're looking at like 0.6 of a millimeter. You've probably heard me say before that we can do no prep veneers as thin as 0.3 of a millimeter. And so the doctor has done some reduction here. In fact, you saw what that looked like a minute ago on the scan, but here are the preps. So there definitely has been some facial reduction. And as a result, we're able to get 0.6 of a millimeter, and we can really be exact about this. In the older days, it would all be done with a Bowley gauge, where we would come to a spot on the veneer and measure to see how thick it was. Try to just grab that same spot, although it's not all that precise. And that could be 0.6. It looks like it's more than half and less than 1. Could be 6 or 0.7. But of course, the beauty of CAD CAM is knowing exactly how thick we are in our design in certain spots, which is fantastic. And then if we look at that from the incisal, that proposal, we'll pull out just a little bit, and we can see again where the preps are, and we can see where the veneers are designed. We can see it looks like the patient might have veneers here, or it's just kind of a sloppy impression that kind of looks like a veneer margin wrapping the incisal edge. And we can see that this lateral is out from the cuspid, and this lateral is out from the cuspid facially. And so we're able to make these kind of veneers and maintain what the patient has on 7 through 10 and do it at 0.6 of a millimeter. But what are these going to look like in the mouth? And a lot of issues could have been solved had we received a photograph from the doctor of one of these shades next to the stump shades themselves, next to the prep shades, if you want to call it that instead. It's probably a cleaner way to say it, so that we knew exactly how dark it was. Because what we do is we take this proposal and then we can mill a couple of veneers in resin. Actually, these are printed. I shouldn't say mill. These are printed on a 3D printer. We used to mill wax back in the old days, but now we print them. In fact, I grabbed it so quickly, you can still see the sprue marks here. They didn't get the chance to polish this one. This one they had already polished before. And if we take it and put it onto the model, and the interesting thing that we have found about this resin is that it's about the same translucency as, for example, an Emax veneer. And so the V veneers that the doctor actually prescribed would be more translucent, and Bruxer or anterior Bruxer would be probably a little less translucent, although anterior would be pretty close to the same. But when we put this on, we can see the prep right through it. And this isn't dark brown. This is just kind of a light yellow dental stone model. You can imagine that if we really truly had a dark brown stump shade here, how much of that would be showing through the veneer. And so we're able to try this on with just this light yellow dental stone and call the doctor and say, hey, look, we've got an issue. If we go really thin, which is, this is 0.6. We could thin this to 0.3 of a millimeter, but then this is going to show through even more. We've got this dark brown stump shade that you've reported, and we know you want very thin veneers. And these are probably thin enough in terms of contour for fitting in with the other teeth at 0.6. But we can see that at 0.6, we're still going to get the show through from the yellow or the dark brown. So we need you to either prep more and opaque it here. Perhaps we could switch materials. But if we went to Bruxer, it would not be translucent enough because they're asking for a very translucent tooth. Anterior Bruxer is much more translucent. But again, bonding zirconia on a non-retentive prep like this is definitely more difficult than bonding Emax, for example, or those lucite reinforced V veneers. It's not that it's more difficult, it's just that you don't get as high of a bond strength and there's a higher chance of debonds. So the best way to deal with it would probably be to prep more and opaque that facial surface, or just turn them into crowns and prep that lingual and give us more prep there, because we can definitely block it out with Emax crowns, for example, regardless of how dark that stump shade is underneath it. So we're left kind of guessing. Our hands are tied because we know that this light yellow is going to show through, and we really don't know what we're dealing with in terms of that prep shade. We really need to get an idea where it is kind of on this scale. And this is the one that we use the most, this natural dye scale, or prep guide as I call it from Ivoclar. Where is that tooth on this spectrum? Because there's a bunch of dye materials that match all of these. And so if there's a picture of an ND8, and let's say the prep shade's just a little bit lower in value, so it's a little darker but not quite a 9, we can take the 8 and put together a little 9 in there and make a tooth out of it, make it a prep, if you will. So these same preps made out of this material, and then we can try the veneers on and really see what's going to show through. Then we can experiment with opaquing on the inside and see if that's going to work, or if the doctor is in fact going to have to prep more. So as you can see, when you have a couple different things colliding, when you want to go minimal prep, very thin veneer, very translucent veneer, but you have a very dark prep shade, those things can't all coexist. Something has to give. We know we don't want it to be the aesthetics of the final case. That can't give. But the patient has to be informed that for us to pull this off because of these dark teeth, we're going to have to make a thicker material here. It can still be translucent even though it's thicker, but we need to block out that color underneath it. Or the doctor needs to prep more and then put a very high value composite on there to help block that out as well. We would still need a photograph of that with the prep shade guide. So again, we want to be able to construct a dye in the laboratory that's almost an identical shade to what your patient has in their mouth. And that way we can preview it for you when we try the veneers in and try them onto that model. We really get an idea of what you're going to see in the mouth, and we can work much more accurately. So this case would be much easier to progress with a far higher degree of confidence if we just had a picture of one of these prep guide stump shades next to the patient's prep. If we had a photograph of that, we would know what we're going for. It was nice of the doctor to send the OM1 along, but we know what OM1 looks like. That's not the issue here. We need to know what this underlying tooth looks like, and we need to know that we have enough room to make this work. So a thin veneer is going to be incompatible with one of these darker brown shades that you see down here, especially when we need it to be very, very translucent. So this is a case in my own history where I've seen a lot of times this ends up being crowns, and sometimes it's just a conversation where you have to have with the patient, say, we're doing this right just so this will look good. That's our main goal here. Yes. Okay. Well, I know we'd like to be conservative, but for this to look good, I just know we're going to have to wrap it around a little bit more onto the back and take just a little more tooth here. What do you mean by a little? Just a millimeter. A millimeter doesn't sound like much to a patient, even though it does to us. If you said half an inch, now they're getting concerned. But to say we need to take an extra millimeter off doesn't sound like much. If you want to be sure of having aesthetic success on a case like this, you need to lean a little more towards crowns, or certainly prep a little more tooth structure, place some B1 composite over it, still use the natural dye prep shades to show us what we're working with. And that gives your laboratory a chance of making some veneers or some crowns that will not only block out that prep shade, but be translucent and aesthetic as well.
Thank you for that, Dr. D.
You're welcome.
Now let's go to a segment we call Viewer Mail. This week's viewer mail comes from the coolest dentist I know. Sorry, Dr. D. Actually, this is from Dr. Forsberg. He's from Cool, California. And he writes in and says that he has 2 questions for Chairside Live. The first one is, says, Dear Dr. D, I already said that. On episode 127, you said that if you have a study model, you can duplicate the crowns to match those on the study model. I recently had a Bruxer crown made on a patient who also has a sleep apnea appliance, a Herbst, made prior to the crown. Luckily, with only a few minor adjustments, I was able to get the appliance to fit the new crown. Would you be able to duplicate posterior crowns from a study model, increasing the chance that the appliance will still fit without having to remake or modify it?
Yes, Coolio, if I may call you that. That's exactly what we could do. In fact, so whether it's a crown under a Herbst or a crown under a partial that's being clasped, if a dentist takes a good, not an alginate, but a polyvinyl siloxane impression of that, without the partial ends, not like a pickup impression, just an impression of that crown, absolutely, we're going to pour that model here at the lab, we're going to scan it, and then we're going to grab the outside of that wire frame of that scan, and that's going to become our design file for the new crown. And so when you take that crown off and prep it and include the recurrent decay or whatever reason for why you were replacing the crown, or perhaps it's a new crown on a tooth that didn't have one before, we're going to merge the prep from the impression that you send of the prep with the design file and put it on top of that and make it fit, but it's going to have that same external contours. And so more or less it's going to be exactly the same size. Now I say more or less just because there are a couple things that come into play. You know, when we take that exact crown and try to put it down onto the prep, depending on how much you prep, there can be a little bit of play in either direction, but hopefully the contacts will help center that the right way. Sometimes there's slight path of insertion issues, but compared to the old way of doing it, where we're just kind of guessing and then you're kind of adjusting to try to make it, it's much more predictable, much more straightforward, and a much better way to do it. I'm glad that you were able to get your Herbst to fit back down over that crown, but yes, the way you suggest is actually the much better way to do it. Better than, it's still the same thing, you're just taking an impression, but do it without the partial or without the sleep appliance in, so we can see all the contours of the tooth cleanly, and we'll merge that with the prep. So yes, absolutely we can, and love to do that. So if you send those impressions in, we'd be happy to make it that way.
Great, we got our second cool question. Says, also, I've wanted to know that if you take an impression of a prep tooth and a small portion of the impression, say the mesial margin, has some sort of a defect. So you take another impression and you get a defect on the facial, but the mesial margin is good. Is there a way that the computer can meld the two impressions to make one good one, avoiding having to take a third? Before you answer that, he says, and thank you for your show. I was so glad to see Megan back. I was about to ask if you could start wearing a blonde wig.
Oh, not just on weekends, but during the week. Could I start wearing how many O's and so? Just one?
Just one, and he also thanked us for the clock and the Bruxer adjustment kits.
Oh, okay, very good. Well, glad he got those last time. Those only make it out about a third of the time from what I'm told. Well, that's a good question too, Megan's favorite dentist. And yes, we are actually able to do that. Now, I don't want to encourage the Dentists of America to start taking sloppy impressions, but if you send one to us where it's perfect or ideal, except for a bubble on the mesial margin, and then you take another one, as you said, where the mesial is ideal, and we just have a bubble, say, on the lingual margin, we pour both of those, scan both of those, and yes, we can merge those two together so that you don't have to take a third impression. Of course, it's probably always going to work a little bit better if that first impression does have all the details there and it's perfect on its own. That's going to be the best way to do it. There is a chance, and it's just a couple of microns when we merge two things together where there's a little fudging that goes on. But certainly compared to the old days of trying to fake it on stone models, it's much easier for us to do in the digital environment. And so yes, if you're happy with one impression except for one little bleb somewhere, and you take another one and you start injecting right there to make sure that you get it, and you end up with a bubble somewhere else, don't worry about that. But we don't want to do it where, you know, this one has 2 voids on it, this one has 3, this one seems to get 2 of those, but you know, we don't want to put 4 of them together. But I think 2 is a reasonable number. So yes, that can be done. And we're starting to see that in the software of a lot of the digital impression units as well. So if you upgrade to a digital impression unit and you scan the preparation and it looks good everywhere except for one area where there was a little blood or saliva, the tissue was touching the tooth, and you go back in with your diode laser and just trim that away or dry it off, you can scan just that one area and stitch it into that digital impression before you send it to the lab, much the same way we're doing it in that software. So this is another good example. In fact, both your questions are good examples of how CAD CAM dentistry really has changed things and really has made it easier for us as a laboratory and for you as a dentist and for us as a team working together to get better results, you know, even when things aren't perfect, because they rarely are perfect. So thank you for both those questions. I appreciate it. As a former gift winner, unfortunately, I don't think you're allowed to win gifts again according to the bylaws of Chairside Live, but we can still give away a picture. Do you have one that we can?
Well, of course I do.
He's got the clock, he's got the burr kit.
He's got everything at this point, but he doesn't have one of these photographs.
Right.
So this is from, I believe, yes, last week's episode. We have one where I'm not sure exactly what's happening.
Look at you.
Yep, I look disappointed or something. I'm not sure what's happening.
Look at you. You look more beyond disappointed. You look devastated.
What could you have possibly said right there that would crush my spirit like that?
It looks like I just gave you some bad news about Parker or something.
Stop it.
Sweet little puppy of all
Parker.
puppies.
And then we also have this photograph where we're just smiling.
Yeah, I feel like
Yeah.
he's going to appreciate the other one better.
Yeah, of
let's
course.
save this for a first timer.
There you-
He's really getting deep into the collection here. The Megan looking slightly nauseous. Thanks, Dr. D. Collection. All right, well, we'll get that sent off to him to Cool, California. Any news today?
Yes. An Arizona woman recently made a startling discovery at the dentist. At a routine dental exam, she took one look at her x-ray and couldn't believe what she saw: the face of Jesus in her molar. The woman says her mom passed away from cancer, so she believes the image is her guardian angel. She plans to frame the x-ray and says she feels extra pressure to practice proper hygiene, fearful of getting a cavity in that tooth.
Well, that's cute. I like that.
Jesus,
You
in her
sent
molar.
me the image of that.
Yes.
We call that a pulp stone.
Yep.
But in a dental textbook, that's what that would show up as. But it might be, she might be right. You know, I don't want to say that her guardian angel is not, in fact, living in tooth number 14. There is a chance that that is actually occurring. But I guess I could see where she would think that.
Right, I can see the rough outline of where she might think
Right.
that it's this idealized picture of
Now, what if,
Jesus.
imagine this,
Okay.
what if that tooth gets an abscess and now the dentist has to do an endo access and go through and clean that all out? That would be, he might have a hard time with that, or she might. But at least she's not alone. There's some other things that I pulled up. This was somebody who had found the face of Jesus on a
holy
tortilla.
guacamole.
You know, is that photoshopped or is that real?
That looks photoshopped to me.
That seems a little fake. That
Yeah.
could be fake, I think.
Because the eyes,
Now here's a Cheeto one. That's not the face, but that's
that reminds me of that statue in Brazil.
right.
Rio,
Right, Christ the Redeemer above the bay.
Yep, kind of looks like that, but
Okay,
Cheeto
could
form.
could be the Cheeto
Okay.
form of that. That's a pizza. That seems legit. That doesn't look.
Yeah,
or
I'm just confused as to what I'm looking. Is it just a?
Here are the eyes.
No,
Here's-
I see
oh,
Jesus,
okay.
but the crust. In my heart, the crust is there, but then I don't see like where the cheese and the toppings would be. Is it just?
Oh. So it's like it seems fake. You're saying because it's a
Yes.
weird kind of pizza. Okay, I'll give you
And
that
it
as
kind of
well.
almost looks like he's got like the thorn outline.
That's
like,
true. That's a little.
a
That is a
little
little
too
too
detailed.
good. Right.
Yeah.
Exactly.
But-
Okay. So maybe we've been fooled. I wonder if the dentist or the hygienist turned around and photoshopped that real quickly just to
No,
mess
see,
with
here's
the
the thing
patient.
is that she turned to the hygienist and said, "Do you see what I see?" And the woman said, "Yes, wow, that's crazy. That looks like Jesus." And then but then the patient said that the dentist wasn't too impressed. He just kind of said, "Oh yeah, okay, cool."
Man of science.
Right.
So Chairside Live viewers, if you see Megan or I's face in any food, please send the food item or just an iPhone picture of the food item to us and we will send you a prize. So we're looking for something that looks like the Mr. Clean on the bottle does not count. You can't just send a picture of Mr. Clean and say, oh look, I saw Totola on this. That doesn't count.
And even if you don't find a picture of us on a food, if you have a local delicacy where you're from, remember when we used to
We used to get food.
We did. We got
did.
key lime pie
Right,
from a
right.
dentist in Florida, and we got sourdough bread from a dentist in San Francisco. If you have a local delicacy, listen, I
That's
am
true.
open
Right.
to trying it.
All right. Anything else?
Yes. Miley Cyrus recently took to Twitter to reveal her latest creation. No, not a song, but a necklace made from beads and her recently extracted wisdom tooth. A few days before she showed off her necklace, she posted a series of bizarre pictures of her getting 5 teeth removed. Gauze, swollen cheeks, ice packs, and all.
Yeah, actually more fascinating than the x-ray. I mean, the necklace is the x-ray. So here's her Panorex where you can kind of see what's going on. It's you can see the 4 third molars that are in here way
Right.
back here. Not super difficult. The lower ones that are usually more difficult. were in occlusion, you know, so those probably
Yeah.
came out pretty easily. I'm sure she was under. Not too bad, really. Almost any general dentist could have done this. The interesting things you notice on this x-ray, you can see her veneers. And it looks a little like the case of the week that we showed today on the scan, where you can see the preps underneath there. So she's definitely got veneers, and then she's had one root canal on a lower anterior tooth. I'm going to guess an older brother or a younger brother throwing a rock or getting hit with the head or something like that. You see that sometimes on people on an otherwise great set of teeth, because look, there's no fillings. There might be some composites. It's a little hard to see on the Panorex.
Right.
Couple pulp stones too, so I don't know if she has a guardian angel in any of her
She might
teeth
have
as well.
Jesus too.
And what's really cool, I kind of
needs
think
them.
not. I kind of think not. Maybe his opposing member might be in there as well.
gosh.
Little of the devil in those molars. But then she posted pictures of those teeth, which I thought it was absolutely fantastic. Are you sure it was 5, or were you just counting from this picture? Or did you read 5?
I read 5.
Okay, because you can only see 4 on that Panorex, and
Right.
here it's a little hard to tell because one of them looks sectioned, and I couldn't even tell if it was part of this one. But it does look like she may have had 5 of these, which is kind of crazy. Can you see the decay on that one? Going down into that. So that's why those need to be taken out. But otherwise, perfectly healthy teeth, just not enough room for them. And I thought that was cool. So you can see this is in a sterilization bag. So anytime patients ask to take something home, you'll usually put it in a bag like this, seal it, and let them take it home, never knowing what they're going to do. And Miley went ahead and made a necklace with
out
it.
of
So
it. That's
I thought
just
that was
so
cool.
odd.
But when you look at her Instagram feed, there's some weird pictures on there, huh?
It is, honestly, I looked at it for research purposes to look and find these pictures, and wow. I mean, I don't follow Miley Cyrus in her career in any way, shape, or form. She's up to some weird stuff.
I'm going to say that a picture of her bloody wisdom teeth was maybe the least shocking thing on there.
100%.
And usually it'd be exactly the opposite.
Right, no,
so.
that was like, just breezed right through that one.
Well, we wish her all the best. I wish she'd sell some of those on eBay. I would love to purchase one of her teeth or two and just have them sitting here for Chairside Life.
I'm okay.
I felt like I saw my face in one of those, but I'm not sure. You never know.
It hurts.
Well, that about wraps it up for this edition of Chairside Live. On behalf of myself, Megan, the whole CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time.
Thin veneers that are very translucent on a very dark stump shade. Sure, want us to, can we cure cancer and solve world and
Didn't expect that, did ya? Thank you for that. Stop.
the dress? I'm sorry, it has me hypnotized.
This week's view. Hey now, and welcome to episode 131. An Arizona. Sorry, I don't know why that was so weird.
That is the actual Indian pronunciation. It's Arizona. It's kind of like pho, the way it goes up. Smart. He's really getting deep into the collection here. The Megan looking slightly nauseous. Thanks, Dr. D.